right? So that's, I think, a coping mechanism that could be very bad, but it also has these positive traits to it, with hypervigilance. And I think it lends itself well to a career in emergency medicine, right?
Yeah, I think that hypervigilance and you kind of framing yourself as a watcher is like a next level skill, because I think you pick up on cues that maybe a lot of people probably don't. You know, you probably see that patient that's getting a little agitated and maybe they're all of a sudden going to be violent, and you can kind of see that and try to de-escalate it before it, comes to a head and they actually are violent. But I think a lot of people, without experience don't see those cues before they happen, and it can make them get blindsided by certain things, or, even a patient that's going to crash soon. If you can pick up on those cues, they're usually there, but we just may not notice them if you're not being hypervigilant in certain situations, or if you haven't had the experience of seeing a bunch of patients crash, you don't know exactly what you're looking at. Um, I see that with new nurses a lot too. Like, hey, this patient doesn't look quite right. Can you come in and just reassess them? And sometimes they just need some reassurance. Like, no, I think this patient's fine. But I always encourage them to bring that to me whenever they're concerned. I want to go look at this patient. And I try to tell the other providers too, like if a nurse is coming to you with a concern, you need to get off your ass and go look at the patient again, because they're in there more than we are as providers. They're at the bedside giving meds and talking with the patient a lot more than we are. And they're going to pick up on subtle cues a lot of times more than we are, because they're at the bedside. And so I always take it seriously. And sometimes the newer nurses just need some reassurance, like, no, this patient's fine. We're going to keep reassessing them. And sometimes you walk in and you're like, holy shit, I'm really glad you grabbed me, because this patient is, decompensating significantly. So I always take their complaints seriously.
Yeah, and I would say that I would much rather go into a room and say, "Oh, okay, no, everything's fine. I think we're good," than to not get the call because they don't trust you or you've snapped at them one too many times and then something goes bad with the patient. I'd rather just have the false call than have the missed call.
Yeah, absolutely. And it's about having good relationship with your coworkers too, so they trust you to, if your EMT partner doesn't trust you, or they're hesitant to say, hey, this patient is looking a little different than when we first started transport. Can we just pull over and have you look at him? If they don't trust you enough to do that, it's going to lead to bad patient outcomes.
Yeah, absolutely.